The government simply acted too late. And minutes from the UK's key pandemic panel make grim reading for number 10, a pandemic response rehearsal conducted back in 2016. It cited the need to strengthen the surge capability and capacity. A former minister involved in exercise Cygnus at the time says the government has been asleep on the job. Now the UK is dealing with the consequences.
Particularly damning, it's particularly detailed, it goes over the timeline, and it's especially damning about the Prime Minister's role in all of this.
Operational exercise Cygnus. Would you know, that's Cygnus with a C, not sickness. Would you know what I'm talking, do you know what I'd be speaking?
Could you tell me what you're talking about?
This is not under your watch, but this is in 2016 when the Conservative government ran a pandemic trial or dummy run called Exercise Cygnus. Ministers then were warned 4 years ago that Britain would be overwhelmed amid a shortage of critical care beds, ventilators, more capacity and, here we go again, PPE or protective kits. The three-day dry run tested how hospitals and other services would cope. Whitehall officials deemed the findings too sensitive to be made public, that no one told the Care Minister.
Been very prepared.
The shortage of ventilators was highlighted in Operation Cygnus and nothing was done. One of the things that came out of the exercise was that certain eye protection equipment was required, and it is reported that you blocked the purchase of that eye kit.
The NHS has been reduced to a logo.
Well, Michael Gove wanted to privatise it, Boris wanted to charge people for using it, and Ian Duncan Smith wanted a social insurance system. The NHS is about as safe with them as a pet hamster would be with an hungry python.
NHS hospitals are being starved of funds, they've been going into financial deficit, the administrators are coming in, they're either being sold off, franchised or closed. Providers who are coming in have new legal powers to decide who gets care, what they can get and what they can pay for. PricewaterhouseCoopers and McKinsey's, which are running the show in the clinical commissioning groups in NHS England and the Department of Health. Virgin, which is bidding for £1 billion, 1% of the NHS budget, never provided care ever, and is taking some of the most vulnerable services for people with mental health and learning difficulties. Care UK, Circle, which is franchising for hospitals, Netcare, many of them American, South African, Canadian companies from all around the world. So £112 billion of NHS funds are flowing to hundreds of commercial providers, shareholders and banks every day of the week, £112 billion. The companies that now in the UK, like Hospital Corporation of America, are being done for fraud and embezzlement and treating patients for heart surgery that they didn't actually need.
We need to remove the private sector from all public services. Services have been used as a cash cow.
The NHS has been reduced to a logo act that brought in the 1948 NHS, the 1946 Act. Beautifully simple, short, succinct and concise. And this is the Abolishing Act, 457 pages of it. The Act removes the 60-year duty on the Secretary of State to secure and provide healthcare for all citizens throughout England. They've abdicated themselves of responsibility and gives the Secretary of State powers to create a market. And, above all, it gives powers to new providers and insurers to pick and choose which patients will get treated, who will get care, and what services will be provided for. Squander. The BMA actually voted against the NHS, but they were later bought off. It should be universal, there for everybody, free at the point of delivery. Above all, it gives powers to new providers and insurers to pick and choose which patients will get treated, who will get care, and what services will be provided for. It knows that insurers are risk-averse, and risk selection is the basis of a market. It's designed to enable the purchasers and the providers to pick and choose the profitable patients and treatments and dump those that can't afford to pay. Insurance funds, these clinical commissioning groups, take members from all over the country. But not everybody can become a member. Because to become a member, you don't join a CCG, you have to join your general practice. But older people may find it increasingly difficult if they're high risk or have multiple needs. And they'll be excluded in two ways, either by entrepreneurial GPs, such as those run by Virgin, or they'll be excluded because they've got chronic diseases, and the CCGs will no longer commission care for them, so they'll have to pay or do without part of a CCG. So clinical commissioning groups are insurance-based, they're not area-based. Not everybody in an area is automatically covered anymore. People are recruited on the basis of belonging to a general practice, but people can become excluded or ineligible either because of their conditions of treatments or because of their own status. And the same has happened. This volume here has given huge new powers to these NHS providers. Services broken up across the country, out to tender to commercial companies. There's not a day goes by when you hear of huge contracts. NHS hospitals are being starved of funds, they've been going into financial deficit, the administrators are coming in, they're either being sold off, franchised, or closed down. These new commercial providers who are coming in have new legal powers to decide who gets care, what they can get, and what they can pay for. PricewaterhouseCoopers and McKinsey's, which are running the show in the clinical commissioning groups in NHS England and the Department of Health. Virgin, which is bidding for £1 billion, 1% of the NHS budget, never provided care, ever, and is taking some of the most vulnerable services for people with mental health and learning difficulties. Care UK, Circle, which is franchising for hospitals, Netcare, many of them American, South African, Canadian companies from all around the world. So £112 billion of NHS funds are flowing to hundreds of commercial providers, shareholders and banks every day of the week. But of course it's not about patient choice, it's about giving providers choice of patients. The other thing is the government said markets are much more efficient, but of course they're not. There's not a country in the world that delivers universal healthcare through a market, not one country. And if anything, all the evidence shows that when you bring in a market, it becomes much more expensive. Look what happened from 1948 onwards. Healthcare costs remained around 3 or 4% of gross domestic product. The big increases happened at the period of privatisation. So from always being between 4 to 6% of GDP, it's risen dramatically. But the second thing that we should remember is the American healthcare system. America is what it's modelled on. 18% of GDP, the outlier at the very end. Twice what Britain's GDP is. And yet, in America, 61 million people, 1 in 5 people go without health care. They have no health insurance or coverage. 2/3 of all medical bankruptcies are due to healthcare bills. And millions of people spend 10% on healthcare costs. And it brings enormous new inefficiencies to the market that's not there in a publicly owned system. The first is insurers, marketing, billing, pricing, profit, insurer billing, physician billing, and hospital billing. Take a bigger and bigger, and then the administration costs. So that only 60%, 60 to 64% is left for medical care, to employ the staff, to buy the drugs, to buy the medicines. In the NHS, it was the most efficient system in the world. It was only 6% of the total budget went on administration costs, compared with what happens in the US, where it's between 30 to 40% that somebody will pay for. And the Institute of Medicine in the US has come out at nearly $3 trillion spending in the US, where more than $1 billion, $1.5 billion is completely wasted. Sorry, $1 trillion is completely wasted. The noughts are too many to comprehend. Unnecessary services. The companies that now in the UK, like Hospital Corporation of America, are being done for fraud and embezzlement and treating patients for heart surgery that they didn't actually need. Inefficiently delivered services, excess administration costs, prices that are too high, misprevention opportunities. From the most distinguished Institute of Medicine report, over $1 trillion.
The NHS is about as safe with them as a pet hamster would be with an hungry python.
My daughter nearly died. The consultant didn't come in. There are not enough people on this ward. There are not enough doctors. There are not enough nurses. The NHS has been destroyed. And now you come here for a press opportunity.
Well, actually, there's no press here.
What do you mean there's no press here? Who are these people?
Stop the NHS being used as a cash cow by a profit-hungry pharmaceutical industry.
Form the National Health Service to kick the privateers out. Services have been used as a cash cow, screwing down the workforce that they employ, cutting back on their terms and conditions, and diminishing the quality of service to the general public. And we see that with the winter crisis in the National Health Service, which is apparently the National Health Service never been better prepared. People are dying while they're waiting for an ambulance to arrive. People being treated on corridors. I mean, it's an absolute appalling mess. But if you look at the cost to the National Health Service of buying drugs and medicines from the pharmaceutical industry, it is colossal. I think that would be better done, frankly, by the public sector. The public sector is perfectly capable of undertaking research and development. And indeed, many of the great leaps forward that we've made, technologically speaking, have actually been achieved thanks to the innovation in the public sector.
In the NHS, but some of it is actually to do with the amount of money the NHS is paying for medicines, often paying big pharmaceutical companies, British, Swiss and American pharmaceutical companies, who are massively overinflating the price of their medicine. 29% rise in 5 years of the amount of money, just a rise in the amount of money the NHS pays for its medicines. 22-fold. But if we're subsidising it, let's put conditions on those. And what it means is now we're at a stage where really vital medicines that we all need because our entire medical knowledge depends on them, like antibiotics, haven't been researched properly because the pharmaceutical companies say we don't want to go near that because there's not enough money to be made.
The senior minister responsible for the Cabinet Office is Michael Gove, and the Secretary of State for Health is Matt Hancock. Did they read the exercise Cygnus report, yes or no? If so, what did they learn from it? Did they conclude that we were well prepared for this pandemic? If so, why? And if they concluded actually that we did have a PPE kit problem and a ventilator capacity problem and a testing capacity problem, then why did they not act in January?
And we know that serious mistakes have been made.
Mistakes on forecasting, mistakes sourcing PPE, on testing, on tracing. And now the UK is dealing with the consequences.
Of this kind, warning, frankly, is what was happening in China at the beginning of January. The new virus developing, which has a high death rate and which is highly infective. The infectivity rate of this virus is very much higher than the normal flu virus. As soon as we knew all of that, we should have been putting into train all of the procedures we needed to see happening.
It's obvious that mistakes were made at the beginning. We did lock down later than other countries.
Professor Tricia Greenhalgh says that scientists have been concentrating on evidence of how well masks protect the wearer.
Face coverings is going to be one way that we can all get back to work, sooner. I was on a programme yesterday with a policymaker who said the best barrier is your own front door. Well, that's all very well, and I agree with that, but that means lockdown's going to last forever. If we want to come out of lockdown, let's take that front door in front of our face and let's just wear a face covering.
Always look no NHS. Always look no NHS. Always look.
Boris wanted to charge people for using it.
Thank you all very much.